Thank you. All right. Good afternoon, everyone. So my name is Sabeen Dhanani, and I'm the Deputy Director for Technology at the U.S. Agency for International Development. And at USAID, we believe that technology has the power to, AI specifically has the power to transform all of our development and humanitarian work. So today I'm going to be sharing one example of how USAID is using AI in our work. I'm going to be telling you what made that example successful, and then I'm going to be sharing what we are doing to develop the wider AI ecosystem in the countries where we work. So, one example of how USAID is using AI to advance the SDGs is in the diagnosis and treatment of tuberculosis. So, as many of you know here, tuberculosis is a highly contagious disease. It is spread through droplets in the air. So, if an individual who has TB coughs or sneezes, individuals around them are then diagnosed with TB. Luckily, TB is treatable, but there's an antibiotic regime anywhere between 6 and 24 months, and many people fall off of that treatment cycle. So, in 2020, USAID partnered with the government of India, the Ministry of Health, and Wadhwani AI, and together we developed the Trace TB project. Trace TB used 3 different AI-based solutions to diagnose and treat tuberculosis. So the first solution is this one over here, which was a mobile app where you could cough into the app, and then the app would layer that information along with other comorbidities and demographic information, and it was able to diagnose if you had TB. And we actually found that this was more effective than the traditional rules-based methods for diagnosing TB, which when you think about a country as large as India, where you have varying levels of expertise within healthcare workers, this ended up being extremely effective. This particular application was built using 15,000 coughing sounds that were provided by the Ministry of Health to this project. The next example that we have is a computer visioning program. So what we are seeing when it comes to TB is an increase in drug-resistant TB, which is still treatable, but we need to know that the individual is resistant to traditional antibiotic regimes in order to treat them accordingly. So traditionally, we would use these. These are called LPAs, or line probe assays. And these are DNA tests that were used, and then a lab technician would then interpret these results and then determine if somebody was had drug-resistant TB. As you can imagine, it took a very long time for a lab technician to look at these results. So using this computer visioning program, we were able to significantly cut down on the time and diagnose these individuals a lot sooner, which helped get them on the proper treatment regime. And finally, the third example that we have here is, like I said at the beginning, TB is treatable, but it takes between 6 and 24 months of an antibiotic regime. So, and a lot of people fall off of this regime for a variety of factors. They may be demographic, they may be societal, there may be issues related to their jobs or their movements, and as a result, people don't complete the regime. They continue to transmit the disease, and in many cases, they become resistant to the traditional antibiotic regimes. So, so we trained a data set using over 8 million users, and we put in a bunch of factors, including gender, location, the time between the diagnosis and the treatment, their occupations, etc., to identify patients that were the most likely to fall off the treatment regime. And then we offered early interventions for those patients in order to, make sure that they didn't fall off. And so to date, this early intervention program has been deployed in 8 states in India and reached over 70,000 patients. So these are 3 examples of how USAID is using, used AI to address a specific problem. And I know what everyone is thinking. Sounds great. Do it all over the world. Let's treat TB. But I think what everyone also knows is that there's a number of factors in India specifically that made this particular intervention a success. So the first factor is we had access to data. We had access to a lot of data that was provided by the Ministry of Health, and we needed that data to build and train the AI models. That's simply not the case in many of the countries where USAID works. Second, there was a lot of local capacity in India. We partnered with a local organization that built this model, understanding the local context, recognizing the local problems. Again, this is simply not the case in a lot of countries where we work. And finally, for anyone who's been to India, spent time in India, India has excellent digital infrastructure. They have excellent digital public infrastructure in the form of digital IDs. They have excellent connectivity, and they have access to computing power. And all of these were really key in terms of developing this solution. So in many of the countries where USAID works, this is simply not the case, which is why we are not only committed to thinking about how we can use AI to solve specific development problems like tuberculosis, but how we can support the wider AI ecosystem in the countries where we work. So, what are we doing? The first thing we have is many years ago we published the AI action plan for USAID. This is public, it's online, you're free to look at it. And this really charts out a course for both USAID but also other development actors about how we should be responsibly embracing AI, right? So the purpose here is that we should not only be looking at it to develop specific solutions, but we should be thinking how we partner with organizations on the ground and how we use these tools in a responsible manner. Second of all, we're developing our own partnerships. So last year at the UK AI Safety Summit, we announced a partnership with the UK government, FCDO, the German government, GIZ, the Canadians, IDRC, and the Bill and Melinda Gates Foundation. And we recognize, look, we're all making investments in AI. Why don't we work together to make to target our investments so we can address many of these underlying issues? And these issues include access to data sets, specifically in local languages. They include increasing access to computing power, and they include building the local capacity. And so we've started with Africa and really thinking together about how we target our investments accordingly. We've also partnered with the Mozilla Foundation to expand the Responsible Computing Science Challenge. So this is a challenge that Mozilla has done for many years in the United States. We've taken this challenge to Africa and to South Asia. And again, the intent here is as we train the next generation of technologists, we do it in a way so that they are empowered to think about these new tools, again, in their local context and how they can be done in a manner that is responsible and addresses these wider ecosystem level challenges. And finally, we're developing foundational insights on AI in the Global South. So I hope many of you joined our workshop yesterday on the AI and Global Development Playbook that we had downstairs. So the playbook and then also the Global AI Research Agenda, these are both actions under President Biden's executive order on safe, secure, and trustworthy AI. And we are developing these along with our partners at the State Department, the National Science Foundation, NIST, etc. And the idea here is that together they will tell a complementary and comprehensive story about AI and global development. What are the best practices that we've learned from all these years of working on AI? What are we hearing from our partners? What are the gaps that continue to exist? How do we empower local communities so that we can ensure that this technology addresses the SDGs? And so we really believe that as we navigate this era of rapid technological change, we have to really do it with purpose and intention. AI has the power to transform the world, to transform the SDGs, but if we're not careful, it will continue to exacerbate existing inequalities. So we at USAID are really committed to thinking about how we can use AI to not only address the challenges that we have, but to also address the wider ecosystem level gaps so that this technology is to the benefit of everyone. And we welcome all of you on that journey. Thank you.